Hello, everybody. This is Nurse Anna from nursestudy.net, and here we have 75 safety and infection control NCLEX questions with answers and rationales. And if you would like one of our free audiobooks with NCLEX questions on ACX or Audible, the links are in the description below. Enjoy the questions.
Question 1. A nurse is caring for a client who has been admitted with a suspected Clostridioides difficile, C. difficile, infection. Which action should the nurse take first to prevent the spread of infection? A. Administer antibiotics as prescribed. B. Isolate the client using airborne precautions. C. Wash hands with soap and water after contact with the client. D. Use alcohol-based hand sanitizer before leaving the client's room. Answer: C. Wash hands with soap and water after contact with the client. Rationale: C. difficile spores are not killed by alcohol-based hand sanitizers. Washing hands with soap and water is the most effective method to remove these spores and prevent the spread of infection. Airborne precautions are not necessary, contact precautions should be used. Administering antibiotics does not prevent the spread of the infection. Question 2. A client with a known latex allergy is scheduled for surgery. What is the most important action for the nurse to take to ensure the client's safety? A. Apply a latex-free wristband to the client. B. Inform the surgical team of the allergy. C. Ensure all equipment and supplies are latex-free. D. Administer prophylactic antihistamines. Answer: C. Ensure all equipment and supplies are latex-free. Rationale: the most critical action is to prevent exposure to latex by ensuring all equipment and supplies used are latex-free. While informing the surgical team and applying a latex-free wristband are important, they do not directly prevent exposure. Prophylactic antihistamines may not prevent a severe allergic reaction. Question 3. A client with dementia is found wandering in the hallway. What is the most appropriate initial action for the nurse to take? A. Restrain the client to prevent further wandering. B. Call security to escort the client back to their room. C. Gently guide the client back to their room and ensure they have a visible identification band. D. Administer a sedative to calm the client. Answer: C. Gently guide the client back to their room and ensure they have a visible identification band. Rationale: the priority is to ensure the client's safety by gently guiding them back to their room and making sure they can be easily identified. Restraining the client or administering a sedative should not be the initial approach as they may cause distress or harm. Calling security is unnecessary at this point. Question 4. A nurse is preparing to administer a medication that requires verification of the client's identity. The client is unable to communicate. Which method is the most reliable for verifying the client's identity? A. Check the client's wristband against the medication administration record, MAR. B. Ask the family member present to verify the client's identity. C. Use the client's room number to confirm identity. D. Verify with the client's chart and MAR only. Answer: A. Check the client's wristband against the medication administration record, MAR. Rationale: the most reliable method for verifying a client's identity is to use the wristband and cross-check it with the MAR. This reduces the risk of administering the medication to the wrong person. Room numbers are not reliable identifiers, and family members may not always be present or have accurate information. Question 5. A nurse notices that the electrical cord of a client's bedside lamp is frayed. What should the nurse do first? A. Report the issue to maintenance. B. Remove the lamp from the room immediately. C. Tape the frayed area until maintenance can repair it. D. Unplug the lamp and leave it in the room. Answer: B. Remove the lamp from the room immediately. Rationale: The nurse should remove the potentially hazardous equipment from the client care area to prevent any risk of electrical shock or fire. Reporting to maintenance is necessary, but the immediate priority is the safety of the client. Taping the cord is not a safe solution. Question 6. In the event of a chemical spill in the hospital, which action should the nurse take first? A. Evacuate all clients from the area. B. Identify the chemical and consult the Material Safety Data Sheet, MSDS. C. Cover the spill with a cloth and notify the housekeeping staff. D. Attempt to clean the spill using standard cleaning supplies. Answer B. Identify the chemical and consult the Material Safety Data Sheet, MSDS. Rationale: the first step is to identify the chemical and review the MSDS to understand the risks and appropriate measures for handling the spill. This information will guide the nurse on whether evacuation is necessary and what type of personal protective equipment, PPE, is required. Attempting to clean the spill without this information could be dangerous. Question 7. A nurse finds that a newly admitted client with tuberculosis, TB, is in a semi-private room. What is the nurse's priority action? A. Inform the client that they will be moved to another room. B. Notify the infection control team immediately. C. Move the client to a negative pressure isolation room. D. Ensure the client's visitors wear masks. Answer C. Move the client to a negative pressure isolation room. Rationale: clients with TB require isolation in a negative pressure room to prevent the spread of airborne particles. The immediate priority is to ensure appropriate isolation. Notifying the infection control team and informing the client are important but secondary to ensuring proper isolation. Question 8. A nurse is caring for a client receiving chemotherapy and observes that the client's white blood cell count is critically low. What precaution should the nurse implement to protect the client? A. Encourage the client to wear a mask when outside their room. B. Restrict fresh fruits and flowers in the client's room. C. Place the client in contact isolation. D. Limit the client's visitors to immediate family only. Answer B. Restrict fresh fruits and flowers in the client's room. Rationale: clients with low white blood cell counts are at increased risk for infections. Fresh fruits and flowers can harbor bacteria and fungi that may be harmful to immunocompromised clients. While encouraging mask use and limiting visitors are also protective measures, restricting potential sources of infection is more directly related to the specific risk. Question 9. During a code blue situation, a nurse observes that the crash cart is not fully stocked. What is the most appropriate action for the nurse to take immediately after the situation is resolved? A. Report the issue to the nurse manager. B. Refill the crash cart with the missing supplies. C. Complete an incident report. D. Notify the central supply department. Answer C. Complete an incident report. Rationale: an incident report should be completed to document the shortage and ensure corrective actions are taken to prevent future occurrences. This is a critical safety issue that needs formal documentation and investigation. Refilling the cart and notifying the appropriate departments are necessary but secondary to documenting the incident. Question 10. A nurse is educating a client on the proper use of a home oxygen concentrator. Which instruction is most important for the nurse to include? A. Keep the concentrator at least 5 feet away from heat sources. B. Ensure that the concentrator is plugged directly into a wall outlet. C. You can use the concentrator while cooking with gas stoves. D. It is safe to smoke in the same room as the concentrator if it is off. Answer B. Ensure that the concentrator is plugged directly into a wall outlet. Rationale: it is crucial to plug the oxygen concentrator directly into a wall outlet to prevent electrical overloads and reduce the risk of fire. Keeping the concentrator away from heat sources and avoiding smoking near it are also important safety measures, but direct connection to a wall outlet is the most critical for preventing electrical hazards. Question 11. A nurse observes a colleague accidentally stick themselves with a used needle. What is the first action the nurse should take? A. Encourage the colleague to squeeze the puncture site. B. Report the incident to the supervisor immediately. C. Wash the area with soap and water. D. Document the incident in the employee's file. Answer: C. Wash the area with soap and water. Rationale: the first priority after a needle stick injury is to wash the area with soap and water to reduce the risk of infection. Reporting the incident and documenting it are important follow-up actions, but are not the immediate priority. Question 12. A nurse is administering medications to a client and notices that the prescribed dose of a medication is significantly higher than the usual dose. What should the nurse do first? A. Administer the medication as prescribed. B. Verify the dose with the prescribing healthcare provider. C. Consult the hospital pharmacist for clarification. D. Hold the medication and document the concern. Answer: B. Verify the dose with the prescribing healthcare provider. Rationale: the nurse should verify the dose with the prescribing healthcare provider to ensure that it is accurate and safe. Administering the medication without verification could lead to serious harm if the dose is incorrect. Consulting with the pharmacist and documenting the concern are secondary actions. Question 13. A client with a history of seizures is being discharged. Which safety measure should the nurse emphasize to the client's family? A. Make sure the client avoids all physical activity. B. Install padded furniture covers to prevent injury during a seizure. C. Encourage the client to swim only with a lifeguard present. D. Keep a medication schedule and monitor for compliance. Answer: B. Install padded furniture covers to prevent injury during a seizure. Rationale: padded furniture covers can help prevent injury during a seizure. While monitoring medication compliance and avoiding unsupervised swimming are important, protecting the client from environmental hazards is a key safety measure. Avoiding all physical activity is not necessary and could be detrimental to the client's overall health. Question 14. A nurse is preparing to start an IV infusion in a client with a known history of anaphylaxis to iodine. What is the most appropriate action to take before the procedure? A. Use an iodine-based antiseptic to clean the IV site. B. Ask the client to sign an informed consent form. C. Use a chlorhexidine-based antiseptic for skin preparation. D. Administer prophylactic antihistamine. Answer: C. Use a chlorhexidine-based antiseptic for skin preparation. Rationale: in clients with a known allergy to iodine, alternative antiseptics such as chlorhexidine should be used to avoid triggering an allergic reaction. Using iodine-based antiseptics could cause anaphylaxis. Informed consent and prophylactic antihistamines do not address the immediate risk of allergic reaction from skin preparation. Question 15. A client in a long-term care facility has been identified as a high fall risk. What is the most effective intervention to prevent falls? A. Place a fall risk sign on the door. B. Use bed and chair alarms. C. Restrict the client to bed rest. D. Ensure the client has non-slip footwear. Answer: B. Use bed and chair alarms. Rationale: bed and chair alarms can alert staff when a high fall risk client is attempting to move, allowing for prompt intervention. While placing a fall risk sign and ensuring non-slip footwear are helpful, alarms provide immediate alerts to prevent falls. Restricting the client to bed rest is not advisable as it can lead to other complications. Question 16. A nurse is reviewing the care plan for a client with a central venous catheter. Which intervention is most critical for preventing catheter-associated infections? A. Change the catheter dressing daily. B. Use sterile technique during catheter insertion and care. C. Flush the catheter with saline before and after medication administration. D. Rotate the catheter insertion site every 72 hours. Answer B. Use sterile technique during catheter insertion and care. Rationale: using sterile technique during catheter insertion and care is essential to prevent infections. While other measures like changing dressings and flushing the catheter are important, sterile technique is the most critical to avoid introducing pathogens. Question 17. A nurse is caring for a client with a positive methicillin-resistant Staphylococcus aureus (MRSA) culture. What is the most appropriate type of isolation precaution for this client? A. Airborne precautions. B. Droplet precautions. C. Contact precautions. D. Protective isolation. Answer C. Contact precautions. Rationale: MRSA is primarily spread through direct contact. Therefore, contact precautions are necessary to prevent transmission. Airborne and droplet precautions are not required unless the infection involves the respiratory tract in a way that spreads via these methods. Protective isolation is for immunocompromised clients, not those with MRSA. Question 18. A client receiving home health care has a central line for long-term antibiotic therapy. Which instruction is crucial for the nurse to provide to the client and caregivers to prevent infection? A. Always use sterile gloves when handling the central line. B. Flush the line with heparin solution daily. C. Clean the catheter insertion site with alcohol daily. D. Change the central line dressing weekly. Answer A. Always use sterile gloves when handling the central line. Rationale: using sterile gloves when handling the central line is crucial to prevent infection. While flushing and cleaning protocols are important, maintaining a sterile environment during any handling of the line is the most critical aspect of infection prevention. Question 19. During a routine check, a nurse finds that a client has developed a pressure ulcer on their sacrum. What is the first action the nurse should take? A. Apply a hydrocolloid dressing to the ulcer. B. Reposition the client and assess the ulcer. C. Notify the wound care nurse. D. Increase the client's protein intake. Answer B. Reposition the client and assess the ulcer. Rationale: the first action is to reposition the client to alleviate pressure on the area and then assess the ulcer stage and condition. This information is critical for planning appropriate interventions. Applying dressings, notifying specialists, and nutritional interventions follow the initial assessment and repositioning. Question 20. A nurse is preparing to discharge a client who requires home oxygen therapy. What is the most important safety instruction to include? A. Do not smoke while using oxygen. B. Store the oxygen tanks in a cool, dry place. C. Check the oxygen flow rate daily. D. Use water-based lubricants to avoid dryness. Answer A. Do not smoke while using oxygen. Rationale: smoking while using oxygen poses a severe fire hazard. This instruction is crucial for the client's safety. While other instructions about storage, monitoring flow rate, and avoiding oil-based products are important, preventing fire hazards is the most critical safety concern. Question 21. A nurse is observing a new graduate nurse perform a sterile dressing change. The new nurse accidentally touches the sterile field with their bare hand. What should the observing nurse do? A. Continue to observe without intervening. B. Remind the new nurse to wash their hands. C. Immediately inform the new nurse of the contamination and have them restart. D. Take over the procedure to ensure sterility. Answer, C. Immediately inform the new nurse of the contamination and have them restart. Rationale: the observing nurse should immediately inform the new nurse about the contamination to prevent the risk of infection. The sterile field is compromised, and the procedure must be restarted with a new sterile setup. It is also a teaching opportunity for the new nurse. Question 22. A nurse is caring for a client with a history of deep vein thrombosis, DVT, who is currently on anticoagulant therapy. The client reports pain and swelling in the calf. What is the nurse's priority action? A. Apply a warm compress to the affected area. B. Elevate the leg and notify the healthcare provider. C. Administer the prescribed anticoagulant. D. Encourage the client to ambulate to improve circulation. Answer, B. Elevate the leg and notify the healthcare provider. Rationale: pain and swelling in the calf could indicate a new or worsening DVT. The priority is to reduce the risk of clot dislodgement by elevating the leg and notifying the healthcare provider immediately. Applying warmth and encouraging ambulation are contraindicated as they may worsen the situation. Question 23. A nurse is preparing to administer an intramuscular IM injection to a client with a history of hemophilia. What precaution should the nurse take? A. Use a larger needle to reduce the number of injections needed. B. Apply pressure to the injection site for at least 5 minutes after administration. C. Use a small gauge needle and administer the injection slowly. D. Avoid administering IM injections and seek an alternative route. Answer, B. Apply pressure to the injection site for at least 5 minutes after administration. Rationale: applying pressure to the injection site helps prevent bleeding, which is crucial for clients with hemophilia. While using a small gauge needle and administering injections slowly are helpful, the most critical action is to prevent prolonged bleeding by applying pressure. Avoiding IM injections altogether is not always feasible. Question 24. A nurse is providing care for a client in restraints. What is the most important aspect of care to ensure the client's safety? A. Checking the tightness of the restraints every hour. B. Offering fluids and toileting assistance every 2 hours. C. Performing range of motion exercises on restrained limbs every shift. D. Releasing the restraints every 2 hours to assess skin integrity and circulation. Answer, D. Releasing the restraints every 2 hours to assess skin integrity and circulation. Rationale: regularly releasing restraints to assess skin integrity and circulation is vital to prevent injury, such as pressure sores or impaired circulation. This action also provides an opportunity to check for continued need and adjust the restraints as needed. While offering fluids and toileting assistance and performing range of motion exercises are important, monitoring skin integrity and circulation is the most critical safety measure. Question 25. A nurse is educating a client who has just been diagnosed with HIV about infection prevention. What is the most important instruction to include? A. You can continue to eat raw foods as long as they are washed. B. Avoid sharing personal items such as razors and toothbrushes. C. It's safe to have unprotected sex with partners who also have HIV. D. Use separate bathroom facilities from others to prevent the spread of infection. Answer, B. Avoid sharing personal items such as razors and toothbrushes. Rationale: avoiding the sharing of personal items like razors and toothbrushes is crucial to prevent the transmission of bloodborne pathogens. Eating raw foods and unprotected sex are risk factors that need careful management, but the direct prevention of bloodborne transmission through personal items is a primary concern. Separate bathroom facilities are unnecessary and do not significantly reduce transmission risk. Question 26. A nurse is preparing a sterile field for a dressing change. After setting up the field, the nurse realizes they forgot to include sterile gloves. What should the nurse do? A. Use non-sterile gloves from the wall dispenser. B. Leave the room to retrieve the sterile gloves. C. Ask another nurse to bring the sterile gloves. D. Use the non-dominant hand to grab the gloves from the storage. Answer: C. Ask another nurse to bring the sterile gloves. Rationale: the nurse should not leave the sterile field unattended, as it could become contaminated. Asking another nurse to bring sterile gloves ensures that the field remains sterile and the procedure can continue without interruption. Using non-sterile gloves or contaminating the sterile field with ungloved hands is not acceptable. Question 27. A client with neutropenia is admitted to the hospital. What is the most important infection control measure the nurse should implement? A. Place the client in a room with a negative air pressure system. B. Require all visitors to wear masks and gloves. C. Implement strict hand hygiene for everyone entering the room. D. Administer prophylactic antibiotics as prescribed. Answer: C. Implement strict hand hygiene for everyone entering the room. Rationale: hand hygiene is the most crucial measure to prevent infections in neutropenic clients. While other precautions like protective equipment for visitors are important, proper hand hygiene is the primary method of preventing the transmission of pathogens. Negative air pressure rooms are not typically required for neutropenic patients, as these are usually reserved for airborne pathogens. Question 28. A nurse is caring for a client on anticoagulant therapy who needs a urinary catheter insertion. What precaution should the nurse take? A. Use a smaller catheter to minimize trauma. B. Monitor the client for signs of hematuria after the procedure. C. Apply local anesthetic before insertion. D. Avoid catheterization and suggest alternative methods. Answer: B. Monitor the client for signs of hematuria after the procedure. Rationale: clients on anticoagulant therapy are at increased risk for bleeding. Monitoring for signs of hematuria after catheter insertion is essential to detect any complications early. Using a smaller catheter and applying anesthetic may reduce discomfort but do not address the primary concern of bleeding. Question 29. A nurse is reviewing discharge instructions with a client who has a new diagnosis of diabetes mellitus. What is the most critical safety instruction the nurse should provide? A. Check your blood glucose levels once a week. B. Avoid wearing open-toed shoes to prevent foot injuries. C. Limit carbohydrate intake to manage blood sugar. D. Take insulin only when you feel symptomatic. Answer: B. Avoid wearing open-toed shoes to prevent foot injuries. Rationale: clients with diabetes are at risk for foot injuries and infections due to neuropathy and poor wound healing. Wearing proper footwear is crucial to prevent injuries that can lead to complications. While monitoring blood glucose and managing diet are important, preventing foot injuries is a critical safety measure. Question 30. A nurse is administering a blood transfusion to a client. 15 minutes into the transfusion, the client reports chills and back pain. What should be the nurse's immediate action? A. Slow the transfusion rate and monitor the client closely. B. Stop the transfusion and notify the healthcare provider. C. Administer an antipyretic and continue the transfusion. D. Check the client's vital signs and resume the transfusion if stable. Answer: B. Stop the transfusion and notify the healthcare provider. Rationale: the symptoms of chills and back pain could indicate a transfusion reaction. The immediate priority is to stop the transfusion to prevent further complications. The nurse should then notify the healthcare provider and monitor the client's vital signs. Continuing the transfusion or slowing the rate is unsafe in this situation. Question 31. A nurse is caring for a client with a tracheostomy. What is the most important aspect of tracheostomy care to prevent infection? A. Perform tracheostomy care every 12 hours. B. Use sterile technique when suctioning the tracheostomy. C. Clean the tracheostomy site with alcohol daily. D. Change the tracheostomy ties weekly. Answer B. Use sterile technique when suctioning the tracheostomy. Rationale: using sterile technique when suctioning the tracheostomy is critical to prevent infections. Regular tracheostomy care and cleaning the site are important, but sterile suctioning directly prevents the introduction of pathogens into the airway. Question 32. A nurse is preparing to administer a high-alert medication via IV push. What is the most critical step the nurse must take before administration? A. Verify the client's identity using 2 identifiers. B. Check the medication expiration date. C. Dilute the medication with sterile water. D. Educate the client about the medication. Question 32. Answer A. Verify the client's identity using 2 identifiers. Rationale: verifying the client's identity using 2 identifiers is crucial to ensure that the correct client receives the correct medication. This is especially important for high-alert medications, which carry a higher risk of harm if administered incorrectly. Checking the expiration date and educating the client are important, but secondary to verifying the client's identity. Question 33. A nurse is teaching a client with chronic obstructive pulmonary disease, COPD, about preventing respiratory infections. What is the most important advice to give? A. Use a humidifier to keep the air moist. B. Avoid large crowds and sick individuals. C. Exercise regularly to improve lung function. D. Get a flu shot every other year. Answer B. Avoid large crowds and sick individuals. Rationale: clients with COPD are at increased risk for respiratory infections, which can exacerbate their condition. Avoiding exposure to large crowds and sick individuals is a key preventive measure. Regular exercise and flu vaccinations are also beneficial, but avoiding infection exposure is most critical. Question 34. A nurse is preparing to administer a scheduled dose of digoxin to a client. The nurse notes the client's heart rate is 55 beats per minute. What should the nurse do? A. Administer the medication as scheduled. B. Hold the medication and notify the healthcare provider. C. Reduce the dose by half and administer it. D. Encourage the client to increase fluid intake. Answer B. Hold the medication and notify the healthcare provider. Rationale: digoxin can slow the heart rate, and a rate of 55 beats per minute is below the typical threshold for holding the medication, usually under 60 beats per minute. The nurse should hold the dose and notify the healthcare provider for further instructions. Administering the medication without assessment could cause bradycardia. Question 35. A nurse is teaching a client with a new colostomy about stoma care. What is the most important point to emphasize? A. Use scented soaps to clean the stoma area. B. Change the colostomy bag every 48 hours. C. Avoid eating high-fiber foods to reduce gas. D. Ensure the skin around the stoma is clean and dry before applying a new bag. Answer D. Ensure the skin around the stoma is clean and dry before applying a new bag. Rationale: keeping the skin around the stoma clean and dry is essential to prevent irritation and infection. Using scented soaps can cause irritation, and changing the bag every 48 hours may not be necessary for everyone. Dietary advice should be individualized. Question 36. A client is on a ventilator and requires frequent suctioning. What is the primary reason for using sterile technique during suctioning? A. To prevent ventilator-associated pneumonia. B. To maintain the client's comfort. C. To ensure proper suctioning pressure. D. To prevent clogging of the suction catheter. Answer A. To prevent ventilator-associated pneumonia. Rationale: using sterile technique during suctioning is crucial to prevent ventilator-associated pneumonia, a common and serious complication in ventilated clients. While maintaining comfort and proper suctioning pressure are important, preventing infection is the primary concern. Question 37. A nurse is caring for a client with a known allergy to penicillin. The healthcare provider orders a cephalosporin antibiotic. What should the nurse do? A. Administer the antibiotic as ordered. B. Verify the order with the healthcare provider. C. Hold the medication and notify the pharmacy. D. Administer a test dose before giving the full dose. Answer B. Verify the order with the healthcare provider. Rationale: there is a potential cross-reactivity between penicillins and cephalosporins. The nurse should verify the order with the healthcare provider to ensure it is safe to administer the cephalosporin. Holding the medication without further action may delay treatment, and administering a test dose without verification is not standard practice. Question 38. A client with a recent hip replacement is being discharged. What is the most important instruction for the nurse to give to prevent postoperative complications? A. Do not cross your legs while sitting. B. Take your pain medication only when needed. C. You can resume all activities after 1 week. D. Keep the surgical site dry and uncovered. Answer A. Do not cross your legs while sitting. Rationale: crossing the legs can cause dislocation of the new hip joint. It is a critical instruction to prevent complications. While managing pain and wound care are important, preventing dislocation is a top priority in the immediate postoperative period. Question 39. A nurse is preparing to perform a blood draw from a client with a known latex allergy. What precaution should the nurse take? A. Use a latex-free tourniquet and gloves. B. Double glove with latex gloves to prevent exposure. C. Apply a latex bandage after the draw. D. Avoid using any gloves to prevent an allergic reaction. Answer A. Use a latex-free tourniquet and gloves. Rationale: using latex-free equipment is essential to prevent an allergic reaction. Double gloving with latex gloves or avoiding gloves entirely would not protect the client. Latex bandages should also be avoided. Question 40. A nurse is providing discharge instructions to a client with newly diagnosed hypertension. What is the most important lifestyle modification the nurse should emphasize? A. Increase your salt intake to maintain blood pressure. B. Exercise vigorously at least once a week. C. Avoid smoking and limit alcohol consumption. D. Use herbal supplements to manage blood pressure. Answer C. Avoid smoking and limit alcohol consumption. Rationale: avoiding smoking and limiting alcohol are key lifestyle modifications to help manage hypertension. Increasing salt intake is contraindicated, and while exercise is beneficial, it should be more frequent than once a week. The use of herbal supplements should be discussed with a healthcare provider. Question 41. A nurse is caring for a client with a chest tube. The nurse notes continuous bubbling in the water-sealed chamber of the chest tube drainage system. What should the nurse do? A. Clamp the chest tube immediately. B. Check for an air leak in the system. C. Increase the suction on the system. D. Notify the healthcare provider. Answer B. Check for an air leak in the system. Rationale: continuous bubbling in the water-sealed chamber may indicate an air leak. The nurse should first check the system for leaks, which could be from the chest tube connections or the insertion site. Clamping the chest tube or increasing suction could cause harm and are not appropriate initial actions. Question 42. A nurse is caring for a client receiving enteral nutrition via a nasogastric (NG) tube. The client begins to cough and gag during the feeding. What is the nurse's immediate action? A. Slow the rate of the feeding. B. Stop the feeding and assess the client. C. Administer an antiemetic medication. D. Encourage the client to take deep breaths. Answer B. Stop the feeding and assess the client. Rationale: coughing and gagging may indicate that the NG tube has been dislodged or that the client is aspirating. The immediate action is to stop the feeding and assess the situation. Continuing the feeding or only slowing it could increase the risk of aspiration. Question 43. A nurse is preparing to administer a potassium supplement IV to a client with hypokalemia. What is the most critical precaution the nurse should take? A. Administer the potassium as a bolus injection. B. Dilute the potassium in a large volume of IV fluid. C. Monitor the infusion rate closely. D. Give the potassium supplement with food. Answer C. Monitor the infusion rate closely. Rationale: potassium should never be given as a bolus injection due to the risk of cardiac arrest. It must be diluted and administered at a controlled rate. Monitoring the infusion rate closely is critical to prevent hyperkalemia and cardiac complications. Potassium is not typically given with food when administered IV. Question 44. A nurse is teaching a client with a new diagnosis of osteoporosis about fall prevention. What is the most important instruction to give? A. Keep your home well lit and free of clutter. B. Avoid all physical activity to reduce the risk of fractures. C. Wear high-heeled shoes for better support. D. Take your calcium supplements only when you feel weak. Answer A. Keep your home well lit and free of clutter. Rationale: keeping the home well lit and free of clutter is crucial for preventing falls, which are a significant risk for clients with osteoporosis. Avoiding all physical activity is not advisable as exercise helps maintain bone strength. High-heeled shoes are not supportive, and calcium supplements should be taken as prescribed, not just when feeling weak. Question 45. A nurse is preparing to assist a client with ambulation for the first time after surgery. What is the most important safety measure the nurse should implement? A. Encourage the client to move quickly to prevent stiffness. B. Use a gait belt to provide support during ambulation. C. Have the client walk unassisted to assess their strength. D. Provide the client with a cane for stability. Answer B. Use a gait belt to provide support during ambulation. Rationale: using a gait belt provides support and helps prevent falls during ambulation. The nurse can assist the client more safely with a gait belt. Encouraging quick movement or walking unassisted could lead to falls or injury. A cane may be helpful, but the initial priority is direct support from the nurse. Question 46. A nurse is caring for a client with an indwelling urinary catheter. What is the most important action to prevent catheter-associated urinary tract infections, CAUDIs? A. Irrigate the catheter with sterile saline daily. B. Maintain a closed drainage system. C. Change the catheter every 48 hours. D. Keep the drainage bag above the bladder level. Answer B. Maintain a closed drainage system. Rationale: maintaining a closed drainage system is the most important action to prevent CAUDIs by minimizing the risk of introducing pathogens into the urinary tract. Irrigating the catheter, frequent changes, and incorrect positioning of the drainage bag can increase the risk of infection. Question 47. A nurse is providing care for a client with multiple sclerosis who has difficulty swallowing. What is the most appropriate intervention to prevent aspiration? A. Encourage the client to eat quickly to minimize fatigue. B. Offer thin liquids to facilitate swallowing. C. Position the client in an upright position during meals. D. Provide large meals to reduce the frequency of eating. Answer: C. Position the client in an upright position during meals. Rationale: positioning the client upright during meals helps prevent aspiration by facilitating easier swallowing and reducing the risk of food or liquids entering the airway. Thin liquids can increase the risk of aspiration, and encouraging rapid eating or large meals is not advisable for clients with swallowing difficulties. Question 48. A nurse is reviewing the plan of care for a client with a history of substance abuse who is exhibiting withdrawal symptoms. What is the nurse's priority action? A. Administer prescribed medications for withdrawal. B. Encourage the client to attend support group meetings. C. Monitor the client's vital signs closely. D. Provide a calm and supportive environment. Answer: A. Administer prescribed medications for withdrawal. Rationale: administering prescribed medications is crucial to manage withdrawal symptoms and prevent complications, such as seizures or delirium tremens. While monitoring vital signs, providing a calm environment, and encouraging support group participation are important, medication administration is the immediate priority. Question 49. A nurse is caring for a client with a fresh plaster cast on their arm. What is the most important instruction to give to the client to prevent complications? A. Avoid getting the cast wet. B. Elevate the arm above heart level for the first 48 hours. C. Use a sharp object to relieve itching under the cast. D. Bear weight on the cast as soon as possible. Answer: B. Elevate the arm above heart level for the first 48 hours. Rationale: elevating the arm above heart level helps reduce swelling and prevents complications like compartment syndrome. The client should also avoid getting the cast wet and using sharp objects under the cast to prevent damage or infection. Bearing weight on the cast should be done according to medical advice. Question 50. A nurse is educating a client with a new colostomy about recognizing signs of complications. What is the most critical symptom the client should report immediately? A. Mild abdominal discomfort. B. Change in stoma color to dark purple or black. C. Increased output of ostomy drainage. D. Skin irritation around the stoma. Answer: B. Change in stoma color to dark purple or black. Rationale: a change in the stoma color to dark purple or black indicates compromised blood flow, which is a medical emergency requiring immediate attention. While skin irritation and changes in output are important to monitor, they are not as critical as changes in the stoma color. Question 51. A nurse is preparing to administer a vaccine to a client who is immunocompromised. What is the most critical consideration before proceeding? A. Verify the client's allergies to vaccine components. B. Ensure the vaccine is stored at the correct temperature. C. Confirm that the vaccine is not a live attenuated vaccine. D. Check the client's vaccination history. Answer: C. Confirm that the vaccine is not a live attenuated vaccine. Rationale: clients who are immunocompromised should not receive live attenuated vaccines due to the risk of developing the disease the vaccine is intended to prevent. It is crucial to ensure the vaccine type is safe for the client's immune status. While verifying allergies, proper storage, and vaccination history are important, the type of vaccine is the most critical consideration. Question 52. A nurse is caring for a client who has just returned from surgery with a new colostomy. The client expresses concern about odor control. What is the most appropriate advice to give? A. Use a deodorizing spray after every meal. B. Avoid foods known to cause odor, such as garlic and fish. C. Change the colostomy bag every time it becomes full. D. Apply baby powder to the bag before attaching it. Answer B. Avoid foods known to cause odor, such as garlic and fish. Rationale: certain foods, like garlic and fish, can cause odor in colostomy output. Advising the client to avoid these foods can help manage odor concerns. Deodorizing sprays and frequent bag changes are additional measures, but dietary modifications are often the most effective. Question 53. A nurse is caring for a client with severe burns and notes that the IV line has infiltrated. What should the nurse do first? A. Remove the IV catheter. B. Elevate the affected limb. C. Apply warm compresses to the site. D. Notify the healthcare provider. Answer A. Remove the IV catheter. Rationale: the first action is to remove the IV catheter to prevent further infiltration and damage. Elevating the limb and applying warm compresses can be done afterward, and notifying the healthcare provider is necessary but not the immediate first step. Question 54. A nurse is preparing to transfer a client from a bed to a wheelchair. What is the most important safety consideration? A. Lock the wheels of the wheelchair and bed. B. Ensure the client is wearing non-slip footwear. C. Use a slide board for transfer. D. Ask the client to assist with the transfer. Answer A. Lock the wheels of the wheelchair and bed. Rationale: locking the wheels of the wheelchair and bed is essential to prevent movement during the transfer, which could cause falls or injury. While non-slip footwear, a slide board, and client assistance can also contribute to a safe transfer, securing the wheels is the most critical step. Question 55. A nurse is caring for a client with a chest tube and notices that the drainage has suddenly increased. What is the nurse's priority action? A. Clamp the chest tube to prevent further drainage. B. Assess the client for signs of respiratory distress. C. Notify the healthcare provider immediately. D. Measure the total amount of drainage. Answer B. Assess the client for signs of respiratory distress. Rationale: a sudden increase in chest tube drainage could indicate a complication such as a hemothorax. The nurse's priority is to assess the client for respiratory distress or other symptoms that may require immediate intervention. Clamping the chest tube could worsen the situation and is generally not recommended. Question 56. A nurse is teaching a client with newly diagnosed type 1 diabetes about insulin administration. What is the most important point to emphasize? A. Always rotate injection sites to prevent lipodystrophy. B. Store insulin at room temperature to avoid spoilage. C. Use the same site consistently for better absorption. D. Mix long-acting and short-acting insulin before injection. Answer A. Always rotate injection sites to prevent lipodystrophy. Rationale: rotating injection sites is crucial to prevent lipodystrophy, a condition that can interfere with insulin absorption. Insulin should be stored according to manufacturer's instructions, and mixing insulin types requires specific guidelines. Consistent site use is not recommended due to the risk of lipodystrophy. Question 57. A nurse is preparing to discharge a client with a history of congestive heart failure. What instruction is most important for preventing fluid overload? A. Weigh yourself daily and report a gain of more than 2 pounds in a day. B. Limit your fluid intake to 3 liters per day. C. Increase your salt intake to improve blood pressure. D. Avoid all physical activity to reduce stress on your heart. Answer A. Weigh yourself daily and report a gain of more than 2 pounds in a day. Rationale: daily weight monitoring is a critical measure for detecting fluid retention early in clients with congestive heart failure. Reporting significant weight gain allows for timely intervention to prevent fluid overload. Limiting fluids and managing salt intake are also important, but daily weighing provides direct monitoring of fluid status. Question 58. A nurse observes that a client's IV site is red, swollen, and tender. What is the nurse's immediate action? A. Apply a warm compress to the site. B. Discontinue the IV and restart it at a different site. C. Flush the IV line with normal saline. D. Notify the healthcare provider. Answer B. Discontinue the IV and restart it at a different site. Rationale: the symptoms indicate phlebitis or infiltration, and the IV should be discontinued immediately to prevent further complications. The site should be monitored, and a new IV line should be established at a different location. Warm compresses can help alleviate discomfort but are not the immediate first step. Question 59. A nurse is educating a client with chronic kidney disease, CKD, about dietary restrictions. What is the most critical nutrient the client should limit? A. Protein. B. Potassium. C. Sodium. D. Calcium. Answer B. Potassium. Rationale: clients with CKD often need to limit potassium intake to prevent hyperkalemia, which can cause life-threatening cardiac complications. While protein, sodium, and calcium intake may also need adjustment, potassium restriction is typically the most critical due to its direct impact on heart function. Question 60. A nurse is caring for a client who has been placed on airborne precautions. What is the most important measure to implement? A. Place a surgical mask on the client when transporting them. B. Ensure the client's room door remains closed. C. Use standard precautions in addition to airborne precautions. D. Limit the client's visitors to immediate family only. Answer B. Ensure the client's room door remains closed. Rationale: keeping the door closed helps maintain the negative pressure environment necessary for airborne precautions, preventing the spread of airborne pathogens. Placing a mask on the client during transport and using standard precautions are also important, but secondary to maintaining the integrity of the isolation environment. Question 61. A nurse is preparing to administer an intravenous, IV, bolus of morphine to a client with severe pain. What is the most critical action the nurse must take? A. Administer the medication rapidly for immediate relief. B. Monitor the client's respiratory rate before and after administration. C. Dilute the morphine in 100 milliliters of normal saline. D. Apply a warm compress to the IV site before administration. Answer B. Monitor the client's respiratory rate before and after administration. Rationale: morphine can cause respiratory depression, making it crucial to monitor the client's respiratory rate before and after administration. Rapid administration can increase the risk of side effects, and dilution is not typically required for bolus administration. Warm compresses are not necessary for IV administration of morphine. Question 62. A nurse is caring for a client with a history of seizures. What is the most important safety measure to implement in the client's room? A. Ensure the client has access to a call bell. B. Place the client in a room close to the nurse's station. C. Keep the side rails up and padded. D. Apply wrist restraints to prevent injury during a seizure. Answer C. Keep the side rails up and padded. Rationale: padded side rails help prevent injury during a seizure. While having a call bell and a room close to the nurse's station are helpful, they do not directly prevent injury during a seizure. Wrist restraints are not appropriate as they can cause harm and are not effective in preventing injury during a seizure. Question 63. A nurse is reviewing the medication administration record, MAR, for a client and notices a discrepancy between the prescribed dose and the dose listed on the MAR. What is the nurse's priority action? A. Administer the dose listed on the MAR. B. Clarify the discrepancy with the prescribing healthcare provider. C. Notify the pharmacy of the error. D. Hold the medication and document the discrepancy. Answer B. Clarify the discrepancy with the prescribing healthcare provider. Rationale: the nurse must clarify any discrepancies in medication orders to ensure the correct dose is administered. Administering the dose without verification could result in harm if the dose is incorrect. While notifying the pharmacy and documenting the issue are important, clarifying with the provider is the immediate priority. Question 64. A client with chronic obstructive pulmonary disease, COPD, requires oxygen therapy at home. What is the most important safety instruction the nurse should provide? A. Do not adjust the oxygen flow rate without consulting your healthcare provider. B. Keep the oxygen tank upright and secure at all times. C. Use an extension cord to place the oxygen concentrator further from the bed. D. Store the oxygen tanks in a closed cabinet to prevent tipping. Answer A. Do not adjust the oxygen flow rate without consulting your healthcare provider. Rationale: adjusting the oxygen flow rate without guidance can lead to inadequate oxygenation or oxygen toxicity. Clients should be instructed to consult their healthcare provider before making any changes. Keeping the tank upright and secure is important, but the flow rate is directly related to the client's respiratory status. Using an extension cord or storing tanks in a closed cabinet can create safety hazards. Question 65. A nurse is caring for a client with a tracheostomy who requires suctioning. What is the most appropriate suction pressure range to use? A. 60 to 80 millimeters of mercury. B. 100 to 120 millimeters of mercury. C. 140 to 160 millimeters of mercury. D. 180 to 200 millimeters of mercury. Answer B. 100 to 120 millimeters of mercury. Rationale: the recommended suction pressure range for adult clients is 100 to 120 millimeters of mercury to effectively clear secretions without causing trauma to the tracheal mucosa. Pressures above this range can cause damage, while lower pressures may be ineffective. Question 66. A nurse is providing care for a client with a chest tube. The nurse notes continuous bubbling in the water seal chamber. What is the most likely cause? A. The chest tube is functioning properly. B. There is an air leak in the system. C. The drainage system needs to be replaced. D. The client is breathing deeply and causing the bubbling. Answer B. There is an air leak in the system. Rationale: continuous bubbling in the water seal chamber typically indicates an air leak in the system, which can occur at the insertion site or along the tubing. The nurse should investigate and correct the leak. While some intermittent bubbling can occur with deep breaths, continuous bubbling is not normal. Question 67. A nurse is caring for a client with a suspected urinary tract infection, UTI. The client reports severe pain in the lower abdomen and back. What is the most appropriate initial nursing action? A. Administer prescribed analgesics. B. Encourage increased fluid intake. C. Obtain a urine sample for culture and sensitivity. D. Apply a warm compress to the abdomen. Answer C. Obtain a urine sample for culture and sensitivity. Rationale: the priority is to obtain a urine sample for culture and sensitivity to identify the causative organism and determine appropriate antibiotic therapy. Administering analgesics and encouraging fluid intake can be done after the sample is collected. Warm compresses may provide comfort but are not the primary intervention. Question 68. A nurse is preparing to administer a blood transfusion. The client has a history of allergic reactions to blood products. What is the most critical action the nurse should take? A. Administer antihistamines before starting the transfusion. B. Use a leukocyte-reduced blood product. C. Monitor the client closely for the first 15 minutes of the transfusion. D. Infuse the blood product slowly over 4 hours. Answer: C. Monitor the client closely for the first 15 minutes of the transfusion. Rationale: the first 15 minutes of a blood transfusion are critical for detecting any adverse reactions, especially in clients with a history of allergies. The nurse should closely monitor the client during this period. Premedication and using specific blood products are important but do not replace vigilant monitoring. Question 69. A nurse is caring for a client with diabetes mellitus who is experiencing hypoglycemia. The client's blood glucose level is 55 mg per deciliter. What is the most appropriate initial treatment? A. Administer 15 grams of fast-acting carbohydrates. B. Give an intramuscular injection of glucagon. C. Provide a snack with protein and complex carbohydrates. D. Call the healthcare provider immediately. Answer: A. Administer 15 grams of fast-acting carbohydrates. Rationale: the initial treatment for mild to moderate hypoglycemia is to provide 15 grams of fast-acting carbohydrates, such as glucose tablets or juice. This should be followed by rechecking the blood glucose level after 15 minutes. Glucagon is used for severe hypoglycemia when the client is unable to take oral carbohydrates. Question 70. A nurse is caring for a client with acute pancreatitis who is receiving total parenteral nutrition, TPN. What is the most important assessment the nurse should perform? A. Monitor blood glucose levels regularly. B. Assess for signs of infection at the catheter site. C. Check the client's weight daily. D. Ensure the TPN solution is refrigerated. Answer: A. Monitor blood glucose levels regularly. Rationale: TPN can cause hyperglycemia, so regular monitoring of blood glucose levels is crucial. While assessing for infection, checking weight, and proper storage of TPN solutions are important, monitoring glucose levels is the most critical to prevent complications from hyperglycemia. Question 71. A nurse is educating a client with chronic venous insufficiency about leg care. What is the most important instruction to provide? A. Wear compression stockings throughout the day. B. Keep your legs elevated when sitting. C. Avoid standing for long periods. D. Apply moisturizing lotion to prevent dryness. Answer: A. Wear compression stockings throughout the day. Rationale: wearing compression stockings helps improve venous return and reduce swelling, which is essential for managing chronic venous insufficiency. While elevating the legs, avoiding prolonged standing, and moisturizing are also important, compression stockings are a key intervention. Question 72. A nurse is caring for a client with an indwelling urinary catheter. What is the most appropriate measure to prevent catheter-associated urinary tract infections, CAUTIs? A. Irrigate the catheter with normal saline daily. B. Maintain the drainage bag below the level of the bladder. C. Replace the catheter every 24 hours. D. Apply antibiotic ointment to the catheter insertion site. Answer: B. Maintain the drainage bag below the level of the bladder. Rationale: keeping the drainage bag below the level of the bladder prevents backflow of urine, which can lead to infections. Routine irrigation and frequent catheter changes are not recommended without specific indications. Applying antibiotic ointment is generally not effective in preventing CAUTIs. Question 73. A nurse is caring for a client with a suspected myocardial infarction, MI. The client is experiencing chest pain and dyspnea. What is the nurse's priority action? A. Administer prescribed nitroglycerin. B. Place the client in a supine position. C. Encourage the client to take deep breaths. D. Monitor the client's fluid intake. Answer A. Administer prescribed nitroglycerin. Rationale: nitroglycerin helps alleviate chest pain by dilating coronary arteries and improving blood flow to the heart. This is the priority action for managing symptoms of an MI. Positioning, breathing exercises, and monitoring fluid intake are secondary interventions. Question 74. A nurse is preparing to administer a high-risk medication that requires double-checking by another nurse. The colleague is busy and suggests the nurse proceed alone. What is the appropriate response? A. Proceed with the administration alone. B. Wait until the colleague is available to double-check. C. Administer a lower dose as a precaution. D. Ask another nurse to perform the double-check. Answer D. Ask another nurse to perform the double-check. Rationale: high-risk medications require a double-check by another nurse to prevent medication errors. The nurse should ask another available nurse to perform the check rather than proceeding alone or altering the dose. This ensures patient safety and adheres to best practice standards. Question 75. A nurse is caring for a client with severe anemia who is scheduled for a blood transfusion. What is the most critical step to ensure the transfusion is safe? A. Confirm the client's blood type and cross-match results. B. Verify the client's identity using two identifiers. C. Monitor the client for any signs of transfusion reactions. D. Ensure the transfusion consent form is signed. Answer B. Verify the client's identity using two identifiers. Rationale: verifying the client's identity using two identifiers is crucial to ensure that the correct blood product is administered to the correct client, preventing potentially fatal transfusion errors. Confirming blood type, monitoring for reactions, and ensuring consent are also important but follow the identity verification process.